In this lesson, we're going to talk about Parkinson's disease. Parkinson's disease is a slow, progressive, degenerative disorder of the nervous system. Now, it primarily affects a structure in the midbrain known as the substantia nigra. You can see here in a normal midbrain, this is the substantia nigra. And what happens in Parkinson's is that structure is atrophied, which means it shrinks or it gets smaller. Now, the primary function of the substantia nigra is the secretion of dopamine. So when we see that atrophy of the substantia nigra, we're going to see a depletion of our available dopamine within the nervous system. Now, if you remember from the impulse transmission lesson, dopamine is a neurotransmitter that helps send signals throughout the nervous system. And it has a lot of functions, but one of the specific functions of dopamine is to help regulate and coordinate muscle movements. And so what we see in patients with Parkinson's disease is that because of this depletion of dopamine, patients are less and less capable of controlled muscle movements. So the signs that we'll see in patients with Parkinson's disease all relate to the fact that they're unable to control their muscle movements. Now, the classic signs that you'll see listed on tests and on your NCLEX are the shuffling gait, bradykinesia, and pill rolling. Shuffling gait is when they are literally dragging their feet across the ground, and this has to do with them just struggling to have enough control to lift their feet up. Bradykinesia is this slow movement. And so a lot of times patients will say they feel like they're trudging through mud or quicksand. And then because of this lack of control, we'll see muscle rigidity and tremors. And one of those tremors is actually called a pill rolling tremor. It's a tremor within their hands that literally looks like they're rolling a pill between their fingers. Now, again, because of this loss of control of muscles, we'll also sometimes see blank facial expressions or even inappropriate facial expressions. And then especially as the disease progresses, they start to lose control and begin drooling or have difficulty swallowing because of the control of muscles within their face and their throat. Now, many times patients will actually start to lose weight because they find it so much more difficult to prepare and eat their food, and they end up having trouble swallowing it. So nutrition actually becomes a priority. Now, every patient's experience with Parkinson's is different. One patient actually described it this way. She said, "I feel like gravity changed and I'm dragging myself through sand now." Ultimately, those slow movements and that inability to control their movements is going to become more and more of a burden. Now, unfortunately, at this point, there's no cure for Parkinson's disease. You may actually know some of the most famous people who have Parkinson's, and that is the late Muhammad Ali and Michael J. Fox. Now, Michael J. Fox actually has his own foundation dedicated to Parkinson's research, and they hope to have a cure within the next few decades. But either way, research is ongoing to help provide more and more treatment options. Now, our current therapies are aimed at increasing dopamine levels within the central nervous system. Now, this includes dopaminergic medications, dopamine agonists, as well as anticholinergics. Now, if you remember from the blood-brain barrier lesson, one of the problems with these medications aimed at that central nervous system is that many of them cannot cross the blood-brain barrier. Okay, so if you remember, we talked about this dopamine agonist that we use for Parkinson's is called levodopa, and this helps to increase our dopamine levels and balance them out. The problem is it cannot effectively cross the blood-brain barrier by itself. So what we do is we add a medication to it called carbidopa. So by adding the carbidopa, levodopa is allowed to be carried across the blood-brain barrier. Remember, carbidopa carries, levodopa levels dopamine. Now, because Parkinson's is a progressive disease, we will find that eventually these medications are less and less effective. And as that muscle contraction gets less and less controlled, patients are going to lose their ability to do basic functions like eat and breathe. So priority nursing concepts for a patient with Parkinson's disease will include functional ability, nutrition, like we talked about, and coping. We need to help them learn how to perform their activities of daily living. And we'll help them use assistive devices to get around. We really want them to be able to maintain their independence as long as possible. As I said before, sometimes nutrition becomes a problem because preparing and eating meals is difficult. So we encourage them to eat small, frequent meals and to make sure that they're getting good, high-quality, nutritious foods. In the hospital, we want to make sure that they're able to swallow safely before we feed them or giving them anything by mouth. And finally, because this is a progressive disease, some patients will need extra help with coping strategies and ways to make the best of the time that they've got left. So remember that the core problem in Parkinson's disease is a depletion of dopamine levels in the central nervous system, and that makes them less and less capable of those controlled muscle movements. Classic signs of Parkinson's are bradykinesia, shuffling gait, and pill rolling tremors. Parkinson's disease is progressive, and the patients will slowly become more and more dependent on others for self-care. So we want to encourage their activity and help them maintain that functional independence as long as possible. Make sure you check out the care plan and the other resources attached to this lesson to learn more about caring for patients with Parkinson's disease. Now go out and be your absolute best selves today. And as always, happy nursing.